morning, everyone. So I'd like to thank you for this opportunity, and it's really great to hear and start to share ideas between universities, because sometimes it feels like we work in isolation, and to hear what's going on at other places is really starting to make us really think and reevaluate what we're doing at our institutions. So I'd like to start by having a look at this little word cloud, and the word that really stands out is that it is a huge responsibility, and we are graduating a generalist pharmacist, but we need a certain amount to be covered before we can actually send them out into the practice world. So in learning and thinking about what we are actually teaching in AMS, I really thought, what do the students need to know before we start with AMS? What subjects teach an aspect of AMS? What do we as lecturers know what has been taught across subject matter? I come from Wits University, and we teach a very didactic course. So what medical micro does in third year, I have to go and find. It's not obvious. It's taught by different departments on a different floor, and I need to actually go and find out and see what is covered there. And I don't know whether the students, when they taught subjects in isolation, how much integration is really happening. And I'm not sold on the modular idea, but I don't think we're getting it right either by teaching it in the didactic model. So I think we really have to go for a mixed method of teaching. So from first year through to fourth year, as I said, we have a very didactic module, a very didactic syllabus. I'm not going to go through each year, but I've just tried to highlight subjects starting in the third year that really focus on antibiotics. I've really, within the next couple of slides, I've only really concentrated on how we teach antibiotics. I know that AMS incorporates a lot more than just antibiotics, but to use that as the example in the foundation. So medical micro is taught in third year. It's a half course. Pharmacotherapy 1 is when we really introduce them into antibiotics. In fourth year, we've got pharmaceutical chemistry, pharmacology, pharmacotherapy, and pharmaceutics, where they learn a lot more about antibiotics. So the medical micro, this is a half course. It's not taught by a department. It's taught by the microbiology department. It is taught in conjunctions with nurses, dentists, and pharmacy students. I think this is, it's great that our students are together in a class with other disciplines. However, sometimes what they don't understand when they walk away is what is the role of the pharmacist within that situation. I just wanted to point out that in terms of antibiotic stewardship, they do 1 hour looking at PK/PD and 1 hour looking at antibiotic stewardship out of a 66-hour course. They do cover all the different groups and the mechanism of actions and go into detail in a lot of other areas, but in terms of AMS, I just wanted to highlight that. For pharmacotherapy, pharmacology teaches them antibiotics, but only in the fourth year, so we need them in pharmacotherapy to understand something about the groups of antibiotic mechanism of action, side effects, contraindications. So we teach them what they need to know to get through third year pharmacotherapy before they retaught that in pharmacology in fourth year. In fourth year, we have a 6 to 8 hour course on antibiotic stewardship. Then in pharmaceutical microbiology, this is in fourth year, we have a component, it consists of lectures as well as a practical component where the students are actually able to get into the labs and put into practice and to calculate the MIC values, to have a look at culturing, to have a look at those techniques, to go through the hand washing procedures. In fourth year, we are then mainly looking at the structure-activity relationships, resistant mechanisms, in terms of the chemistry. Looking at the number of hours, I know that the medical micro course doesn't only consist of antibiotics, so 66 hours might be heavily weighted, but in all the others, we are actually spending about 122 hours in total on antibiotics. And looking at the other programs from other universities, it seems that we are focusing a lot on antibiotics. And I'm just wondering how much the students are leaving with. Are they leading, well, especially from our institution, are they integrating information across these subjects? So as we mentioned, we have an external lecturer, Angeliki Messina. Sorry, I used her her surname before she got married. It is largely based on antibiotic stewardship principles. They get tested in MCQs in the form of tests, in test 1 in the first block of 4th year, as well as in the final exams. We only test them in MCQs, where there are probably a couple of limitations with and not testing them using other formats. We do test them in, for example, respiratory conditions, TB, HIV. We cover a lot of other infections where we teach them about the antibiotics and test about antibiotics in general in those sections. However, antimicrobial stewardship is tested separately as well. Our experiential learning sites, we are quite lucky in Joburg that we have access to a number of hospital sites. We send our students to 19 sites across Joburg over a 14-week period. So we have 7 rotations. So each student goes to a site for 2 weeks. And each student, we have in this class we had 79 students, so each student went to a hospital site visit. We use 5 private hospital sites. Most of them can only accommodate 2 students. There's one hospital that can take up to 4 students. So they spend 16 hours at a private hospital. Most of this time, they are exposed to the antibiotic or the antimicrobial stewardship program at that hospital. However, it is very difficult because it relies that the clinical pharmacist is free during that time, and that there is a clinical pharmacist. At one of the hospitals, they never had a clinical pharmacist for more than a month. So the students that went during that rotation unfortunately didn't get exposure to the antimicrobial stewardship program because there wasn't anyone who was able to take them around or had enough time. So in terms of relying on the private sector, it is difficult for us to say to them, we want our students to have 4 hours of exposure on medical ward rounds within the ICUs, because the private hospitals are governed by their own policies and procedures, and it's difficult for us as the university to dictate what we want our students to learn. We do have discussions about learning outcomes. However, it's very difficult to say we need our students to learn the following at all costs. So we definitely have our students getting the exposure. Are they able to apply what they have been taught? It is very difficult for us to assess. There's a large variation in experience from site to site. So we use 5 hospitals, 5 private hospitals. We use 4 academic hospitals. We cannot expect that each student is going to get the same type of exposure. So the academic hospital sites, very little exposure to antimicrobial stewardship, very little exposure outside of the dispensary is happening. So we would really like to focus on that in the future, and hopefully we can grow that. We do assess our students. Our students need to identify one clinical activity they've been exposed to. Again, difficult for us to say it has to be antimicrobial stewardship. However, 90% of the submissions are on antimicrobial stewardship. They need to describe what they've learned, and they need to have a look at how they would possibly apply this within their future. This is kind of in line with how the interns are expected to submit learning activities or the CPD activities during their internship. So how do students piece together information and experiential learning activities and beyond? It really is a puzzle, and in the real-world situation, I'm not too sure that we are winning. I think that we need to do a lot more assessment in this area. VITS has a major focus on antibiotics, but we need to start questioning what about the rest, fungal and viral infections, the didactic model of teaching. I'm not too sure how this is going to, whether we are winning the war here, and application of antibiotic stewardship is difficult within the experiential learning program, and we need to look at how we do expand. Thank you very much.